Welcome back to another Mahali update, one of our male giraffe who's 16 years old. My name is Dr. Jon. I'm the head veterinarian here at Cheyenne Mountain Zoo, and I'm here with Dr. Liza, Vice President of Mission and Programs. Today we'd like to give you a little bit of an update on some of Mahali's conditions and also let you know what we plan on treating him with during his immobilization to address some of those issues. And the immobilization will occur sometime later this month. So one of Mahali's medical issues includes arthritis in both of his front feet. This condition is complicated by hoof overgrowth, which usually we'll address by trimming his hooves using training. But recently he's regressed in that training and we haven't been able to address that appropriately. Another one of Mahali's issues is ligament injuries, which is probably also causing him to have abnormal posturing when standing and walking. And one other issue that we're addressing is that he has fractures in both of the toes in his front feet. With that in mind, all those medical issues, we have several treatments that we're going to use to address them during his immobilization. And some of those things include trimming all four of his hooves and then also potentially gluing on a shoe. And what that shoe does is act like a cushion that keeps him a little more comfortable afterwards. And then we also plan on doing injections into the joints, which may help with arthritis. And then finally, one other treatment that we plan on doing is stem cell injections, which should help with inflammation and soft tissue damage. So with that in mind, I'm going to let Dr. Liza take over and talk about Mahali's previous immobilizations and some of the team members that are going to help us during next week's procedure.
Thank you again, and thank you, Dr. Jon, for the update. So Mahali, again, our 16-year-old male neuter giraffe, has a long history of having some pretty major foot problems. About 7 years ago, we actually started a voluntary hoof work program here where we were able to start to diagnose and better manage foot problems in giraffes like Mahali. And what we found at that point was already about 7 years ago, Mahali had some pretty advanced arthritis and some foot fractures in both his front feet. But as we started to work with him and started to develop techniques to better manage this, we found that a lot of his soreness could be addressed by simply having him cooperate to trim his hooves, and we were able to bring him a lot of comfort and manage him for quite some time that way. However, over time things progressed with his foot condition, and in 2017 we found that we were at a point where we just simply couldn't maintain his hoof overgrowth anymore. He wasn't, I think, focused enough to be able to participate well for his hoof training sessions because he was uncomfortable. And so at that point we did undertake what can be a risky anesthetic procedure to better address his foot health. And at that time we saw some really impressive clinical improvement with how he did, and we were really happy with his results. We're now 3 years out from that, and unfortunately we're starting to see some signs that his discomfort in his front feet is coming back despite all the medicines that we can give him without anesthesia. And so with that in mind, we're going to do something similar to what we did 3 years ago to help manage his foot comfort better. So we're mobilizing a team that includes our own veterinary specialists, our animal care team, but also outside specialists including Colorado State University Vet School and our specialized farrier who has already built some wonderful shoes for Mahali based on some tracings we did last month. So with this procedure, we're going to close the barn for the day. We're going to really strategize and be as efficient as possible. And we'll have a whole bunch of very specialized teams, including one that's specifically going to be focused just on anesthesia to make sure things stay as safe as possible for Mahali and we give him the best possible chance of having a smooth recovery. Again, he's a 17-foot patient. He weighs literally a ton, but we're going to do everything we can to give him the best possible chance of having a great outcome. We'll keep you in the loop as we get closer to his actual procedure date. And again, we'll be closing the barn for the day of the procedure. We're super grateful for all the kind words that we've been getting from our community and everyone wishing really handsome Mahali the best and all the support for our team as well. Thank you, and we'll update you again soon.